Now I'll turn it over to our CEO to give you more specific updates on CalPERS' response to business continuity. Marcie, please.
Good morning, President Jones and board members. I'll begin this morning by addressing how we have been dealing with the issues surrounding COVID-19. Our top priority has been the safety of our members, our team members, and the public who visit our offices. We are doing this while also maintaining the essential functions of paying benefits, administering our healthcare program, and managing our investment portfolio. Now, obviously, the impact of COVID-19 has forced us to change the way we do business and the way we interact with our members, our employers, our team members, and our stakeholders. So let me outline a few steps that we have been taking. From the outset, we did form a work group that meets daily, if not more often, to review the latest developments and guidance that's coming from CalHR, who has been a great partner throughout this whole event, the California Department of Public Health, the State Government Operations Agency, as well as local health officials. This group includes members of our executive team and representatives from our human resources, operations, services and support, and public affairs. It also includes our Chief Medical Director, Dr. Julia Logan, who has been our source of outreach to the latest developments and has been advising us along the way. Currently, our headquarters is open today, but on Monday, we did close our headquarters, the Sacramento Regional Office and daycare, to clean and disinfect the entire campus after one of our employees showed symptoms of the virus. The good news for the employee and us is that the individual was tested and was negative for the virus. Yesterday afternoon, we made the decision to close our 8 regional offices to all in-person appointments, at least through the end of March, and we will reevaluate at that time. We've contacted members who already had appointments scheduled, and we plan to conduct those appointments by phone instead. We've also postponed in-person training and educational classes for employers and members, and those are typically scheduled in our regional offices, and where possible, we'll reschedule them as conference calls and video conferencing online. And then finally, we postponed our CalPERS benefits education event that was scheduled for April 17th and 18th in the City of Industry. We are looking to reschedule it for a date later this year, and we're working with the hotel closely to make that happen. Now, these changes have been communicated through all our communication channels, including regular updates on our website and through social media. It is important to note, however, that members and employers needing services during this time can do business with us by accessing their My CalPERS account or by calling our customer contact center, which is open. A little bit on the health side. Of course, COVID-19 is first and foremost a significant and serious health matter. And from the start, we have worked closely with CalPERS health plans to ensure our members have access to the care they need. We've asked all the plans to update their websites regularly with information about testing and treatment for COVID-19, and they have done so. And we worked with the plans so that no one enrolled in the CalPERS health program will have to pay any out-of-pocket costs for screening and testing of COVID-19 should they need it. We also have been coordinating with our pharmacy benefit manager, OptumRx, to make sure that members have access to the medications they need. We do not anticipate any interruptions to prescription medications, but we are working very closely with Optum, to make sure medications are received in a timely manner. As our day-to-day business continues, maintaining service to our members and employers while protecting our own employees is essential. Under guidance from CalHR and state and local health officials, we have greatly increased the number of team members who can telework if their work allows them to do so, and after working with their managers. We've also increased the number of laptops and other devices issued to allow greater access to teleworking. For team members who continue to work in our facilities, we have implemented very deep social distancing policies, maintaining a distance of 6 feet between each other in work areas, and speaking one-on-one or in meetings. And we really have asked everyone in the organization to curb meetings and to take care of business via conference call or one-on-one. And then our investment office began preparing weeks ago. Working with IT, nearly all of our investment functions are being managed remotely or through our Emergency Operations Center, and our investment office is conducting their business every day. And you'll get an opportunity to hear from Ben on the market and the portfolio in just a moment. Here on our CalPERS campus, we continue to take several important steps. We've increased our cleaning measures and our cleaning high-touch services throughout the workday. And our cafe has also adjusted its menu, eliminating self-serve items and offering grab-to-go meals. And then one special note before I close out, I want to tell you that we feel very fortunate to have welcomed Michelle Tucker to our team as the new Chief of Human Resources. Michelle started with us on March 2nd, and from the time she walked in the door, even before she had a chance to find her office, she's been dealing with numerous HR issues each day involving our response to COVID-19. So Michelle has handled this with great expertise and skill, and we're very pleased that she is with us during this time and beyond. Many of you may have recognized Michelle Tucker's name. She was the recipient last year of the Spotlight on Excellence award that we had given at our Employer Education Forum. So I'm going to close now by asking Ben to discuss our investments and the recent volatility in the markets, and then we'll both be happy to take some questions at the end.